Hello and welcome to the next episode of the Healthwatch South Tees podcast. This series hopes to bring you stories from across Teesside, hearing from some really interesting charities, organisations and people. My name is Stephen Liggett and I'm a community champion for Healthwatch South Tees, and I'm also a research project manager at South Tees NHS Foundation Trust. And I'll be once again joined by the amazing engagement and volunteering officer for Healthwatch South Tees, Vicky Jackson. A huge thank you for listening, and we hope you enjoyed this episode. Hello and welcome to the Healthwatch South Tees podcast. Here we aim to bring you stories, information and updates from communities and organisations from within Middlesbrough, Redcar and across the South Tees area. My name is Stephen Liggett, one of the many community champions at Healthwatch, and as ever I'm joined by the fantastic Vicky Jackson, the volunteer and engagement officer at Healthwatch South Tees. How are you today, Vicky?
Yeah, I'm great. Thank you, Stephen. Thank you for having us here again. It's another interesting topic that I think we're going to be speaking about today.
Let's just get straight into it, if you like. So, as seems to be the tradition, would you like to run through a little bit about your role first, maybe the work of Healthwatch, and then introduce the guests we have today?
So, my role, I work for Healthwatch, and as Stephen said, I look after our community champions and volunteers. I also do engagement, and I'm currently leading on a project for Redcar and Cleveland adult social care, reviewing different elements of their work, their communication methods. So quite busy, and we're a small team, cover South Tees, so we're helped by a whole bunch of community champions who link in with the local people, and they can spread the word of Healthwatch, but more importantly, they give us feedback on what's happening in their communities. And we've been seeing more inquiries or information feeding through to us really about community pharmacy. Mm-hmm. My community champion Jane couldn't be here today. Well, I think she deferred to Pete.
She wouldn't do it.
She wouldn't do it today. So we've got Pete here from Community Pharmacy Tees Valley, and just would like to thank him for coming along and stepping up to the mark.
Yeah, thanks, Stephen. Thanks, Vicky, for that introduction. So my name's Pete Horrocks. I'm a community pharmacist. I've worked in the area for the last 20 years and have a role within Community Pharmacy Tees Valley as the chair of the representative body that represents the contractors across the Tees Valley area.
So to start us off today, I suppose it follows on from what Vicky just described in the introduction. It's kind of, can you maybe talk us through the journey of patient accessing any services, and is there anything that we can do to raise awareness of this service that you provide, Pete?
Yeah, so obviously community pharmacies offer many services, and the primary one being the dispensing of medicine. So kind of we'll pick up on that point first, and then it'd be great to have a chat about the services that we also deliver. Yeah. So the dispensing of medicines is kind of one of our main essential services, which ensures that we provide to our local populations medicines that are safe and effective for use and suitable for that patient. Obviously, we can only do that in the main when we receive a prescription from a prescriber. And for most people, that's a repeat prescription from their GP. But that journey of a prescription doesn't just start with the pharmacy. It starts a number of days in advance, and usually that's instigated by the patient, in that they understand that they need to reorder the medication. Where we tend to get challenges is when patients may forget to order their prescription or don't give enough days for the system to process that. So what we typically say is a patient should be thinking about ordering their prescription 1 week before they need to start the next medication. So by ordering 7 days in advance, that gives the GP and the GP team enough time to review the request of the repeat prescriptions. They may need to review and do some checks to make sure that the patient's suitable that month, issue a prescription through to the pharmacy. The pharmacy will then be able to check over the prescription to make sure they're still clinically suitable, order the necessary medicines if they don't have them in stock, get that assembled and put it onto the shelf. So that's why we say about seven days is what patients should be ideally looking to reorder their prescriptions. Excellent. All pharmacies will deal with acute prescriptions. So for patients who attend the GP practice and maybe issue an antibiotic script, absolutely they will come straight to the pharmacy and expect to have that done. But around about 60-70% of our workload is that repeat prescription basis, which if patients can order 7 days in advance, and thinking about that particularly around bank holidays and these times when we've got pressures, really does help us all to operate effectively.
We've had, so when we get information in from local people about accessing prescriptions and accessing medication, we quite often will be working with people who might be living a chaotic lifestyle, might not be able to manage their medication as they should, people who maybe are homeless, people who've recently come out of prison, that kind of thing. So one of the things that I would like to know is if a person isn't registered with a GP and they're homeless or they've just come out of prison, how would they address getting their medication if they needed it in the short term? Yes, they would need to register with a GP practice, but say they needed a couple of days or a week or so, is there a way that they can access their medication?
So if they're on regular medications that have been prescribed previously, then there are systems in place to deal with the emergency supply of medicines, and we often see this happening around holiday periods when people might forget to have ordered the medication. So a pharmacy can do what's called an emergency supply, and that is usually done when there's been a referral from 111. Yeah. So patients would typically either access 111 online or telephone the 111 call handlers, and they would be able to send a request through to the community pharmacy that says, please can you review this patient for the supply of an emergency medicine. Yeah. But it is significant that it's only for repeat medicines that the patient is already prescribed, and it wouldn't be for the initiation of any new medicines or new treatments.
Yeah, that's great, thank you.
So you mentioned the dispensing is only a section of the service that pharmacies can offer. Can you talk us through maybe some of the other things that you can access your community pharmacy for, Pete?
Yeah, by all means. So, and I think this is one of the things that community pharmacy doesn't really do very well at publicising what it is. Unless the patient has been and received the service, then they may not be aware. May not be aware of it. So I'm going to run through some of the services that we have. So we do what's called a new medicine service. So for when patients are started on a new medicine that's within the criteria to offer this service, the community pharmacist will contact the patient a couple of weeks afterwards to ensure that they've started that medicine that there's no side effects and there's no issues. That's really important for the NHS, is that when we start a medicine, we want the patient to get the best value for it, and we're not wasting any NHS resources in a medicine that's not taken. It's a really great service that pretty much all community pharmacies will offer. Nice. We then go on to this time of year, thinking about vaccinations, COVID vaccinations and flu vaccinations. So that's a very common service to be available in community pharmacies.
And I think with that, it's really good because for people who are working or carers, you can book an appointment sort of outside the normal hours, can't you? Whereas if you're booking something like that with your GP, it has to be on a specific day. So for people to access that, it's really easy. And I've used it myself and I find it's brilliant because it doesn't impact with my working day.
Yeah, the fantastic thing about community pharmacy is the accessibility it offers.
Absolutely.
Many pharmacies are open throughout the day, long hours, open on evenings and weekends. And what it said is 89% of the population has access to community pharmacy within a 20-minute walk. And in some of the most deprived areas, patients are within a 20-minute walk of their community pharmacy, over 99% of patients. And the other fantastic thing about community pharmacy, you can tell I'm a real advocate for it, is that the people who generally work in our community pharmacies, our staff, come from the local communities. Yeah. So they understand the health inequalities, the social aspects, and some of the other kind of economical issues that local community has. So they can really touch base with patients, and many of them have worked in their pharmacies for years and know people throughout the generations of families.
Yeah. Yeah, and I think they can almost become a little bit of a hub, don't they? Some pharmacies. I know when I went to Healthwatch England conference last year, there was a guy on, and his had become almost like a hub where people could go, they could get the health checked, and they develop friendships. And I do think that they are really valuable assets. Mm-hmm.
So one going back to the services we were talking about there. So earlier on this year, the Pharmacy First service was launched, and this was as a result of the primary care recovery plan. And the aims of that plan was to give patients more choice in how they access care, to cut waiting times, and to free up 10 million GP appointments per year. So the idea of the Pharmacy First scheme is that there's 7 common conditions that previously would have had to go to the general practice for treatments can now be seen within the community pharmacy, and that includes sinusitis, sore throat, earache, infected insect bites, impetigo, shingles, and uncomplicated urinary tract infections. So the pharmacies can accept a referral from the practice. So we might have care navigators in the practice that direct the patient to come to the pharmacy by referral, or some patients will just walk in with any of these conditions and we'll be able to see them.
I think we've got some really positive feedback as a Healthwatch on the Pharmacy First. I think it's people becoming aware that the service is there, isn't it? And then once that word gets around, we've had some really good experiences from people.
Yeah, it's fantastic. It really does open up the availability of appointments and accessibility for patients.
Yeah.
A couple of other services that you'll find in a community pharmacy is the NHS blood pressure service. So obviously, blood pressure is a significant risk factor for coronary vascular disease. So patients over the age of 40 can pop into the community pharmacy if they're not already being treated for high blood pressure. Then the pharmacy team will take the patient's blood pressure, check that it's okay, and send them details on to the GP. If that blood pressure reading is borderline or high, then we book the patient back in to get what's called an ambulatory blood pressure check, and that is a number of readings that are taken throughout the course of the day that gives a much better indication as to whether the patient suffers from high blood pressure. Rather than just on that single reading, and we can also do referrals from the practice as well.
I think this is why discussions like this are so important, because a lot of those services I didn't realise were available at your local pharmacy, and it's really interesting and perhaps an undervalued service, maybe even.
Yeah, I think undervalued, and I think people are just not aware. You're really aware of what's happening in the community because of your job.
Yes. Yeah.
And you're obviously you're a community champion, so you're really aware. And for you to not know about some of those things, it's just quite telling, isn't it? And I think that one of the things that we thought about with doing this podcast was actually to make people aware of what they can access through the pharmacy. Yeah. It's all good.
Yeah, and there's a couple of other services, and a lot of pharmacies not only will they offer NHS services, they'll also offer some private services as well. Things like travel vaccinations would be an example of private services that the patients can get at their community pharmacy. But we also have what's called a Think Pharmacy First scheme, which previously would have been known as a local minor ailments service. Yeah. Again, that is absolutely is there to help those most at need. Because what we do see is a lot of patients will make an appointment at their GP or go to urgent or emergency care because they don't have to pay for something.
Yeah.
Okay, because of the economical issues that we have, particularly in deprived areas. But the Think Pharmacy First scheme, if a patient is eligible to free prescriptions, they'll be able to have a consultation with the pharmacy team, and if suitable, receive medicines free of charge in that instance as well.
Yeah, and I didn't know about that.
Yeah.
So there you go.
And that is a service that's commissioned across the whole ICB.
Yeah, and I think it's getting to those communities who really need to know that information, isn't it? It's we did a recent forum, a multicultural forum, and we sat with people from all different ethnic backgrounds, and we asked them about their experiences around health and care. And I sat with a group of people, and they couldn't speak English. I couldn't speak Iranian. We communicated through Google Translate. But it's like, how do you get that message direct to those communities? It's incredibly difficult, isn't it, to be, because you think, oh, well, we can put something in a different language, but actually that community can't read that language. They can hear it, but they can't read it. So it's really difficult. And I think through networks like ours, like the Health Champions networks, I think it's really vital that this message is shared with people.
And then just to touch on one other, we'll look at kind of final service, without going over the top of the services that pharmacy can offer.
Stephen and I are going to be queuing at the pharmacy.
Yeah. Let me in.
So the other one is the oral contraception service. So many people will be familiar with emergency contraception from community pharmacies. That's a well established service. But in the last 18 months, the pharmacies have been able to offer the oral contraception service. The idea of that is to be able to widen access, and it's part of the NHS's long-term plan. So if a lady was wanting to consider oral contraception, she would be able to make an appointment at the community pharmacy, have that consultation with one of the pharmacists, who would then go through the treatment options, considering whether a progesterone only or a combined contraception would be the best option. We'd also have conversations around long-acting reversible contraception, and come up with a plan of action for that individual patient. And not only that, is that the pharmacies can also, so that's what we class as the initiation service. Pharmacies can also take over the ongoing service. So for a lady who's already receiving oral contraception, is due for their annual review, they can actually get that review done at the community pharmacy, and the ongoing supply can be made from there. So again, it's the idea of freeing up appointments and increasing the accessibility and availability for patients.
Yeah, absolutely.
Community pharmacies are providing a whole range of amazing services that are actually going to make a real difference in their local communities. I suppose, is there any challenges to working in such kind of like a stretched service, Pete?
Yeah, there is, and many of you may well have seen articles in news or posters in the pharmacies warning of the risk to that service, continuing.
Yeah.
And where that comes from is the sector has actually had a pay freeze since 2015. There's been no increase in the contract sum that's given to community pharmacies since that time. Obviously, dispensing has increased, so pharmacies are dispensing more and more prescriptions and doing more and more services, but are still doing this under the same funding envelope. Everybody is well aware of some of the inflationary costs that everybody has faced over recent years with local and global issues. So there's a real kind of crisis point for community pharmacy right now. We are waiting for an announcement or an outcome from the new government with the community pharmacy negotiators, and we do hope that's going to be coming soon, because we've seen a number of pharmacies close. In fact, since 2015, more than 1,000 pharmacies have closed. So it does put a significant risk to the network.
Absolutely. Until
the contractual issues for community pharmacy are resolved at a national level.
And you spoke about before, obviously, it always seems to impact the most deprived areas. You know, if these services are lost, it just increases the pressure in other areas of the service and the system. So you would hope a little bit of investment in community pharmacies and organisations. Actually, overall, you get the return further down the line, don't you?
Yeah. And community pharmacies is quite unique in that it inversely reflects the areas of deprivation. We see more pharmacies in areas of high deprivation.
Yeah.
It supports the local communities.
Yeah, exactly.
But unfortunately, these are the pharmacies that can't offer a private service. because the patients won't be able to afford some of these services. So these pharmacies are most at risk, and some of the ones that have closed have been from the most deprived locations. So we do really look forward to hearing a positive outcome from discussions with the new government, and hope that they will back the sector. And what I would say is that the sector is ready and available and willing to do more, but it does absolutely need to be funded adequately so that the doors can remain open, so we can deliver all of the services that we want to do.
A lot of areas are facing these financial pressures, and obviously an increase in budgets would be absolutely fantastic to maintain this service. You touched on a little bit about it earlier, about if we provide patients with a little bit of awareness regarding timescales and stuff for dispensing and prescriptions. Is there anything else the public could be doing to take the pressures off community pharmacies?
I think that really is a good point. Ordering prescriptions early and having appreciation for the pharmacy team, helps significantly, because it allows the pharmacy team to be efficient in what they do. So that's certainly kind of a key aspect there. And sometimes pharmacy teams are operating under significant pressures. And sometimes we just say, can you please be conscious that these are our members of staff that are here to support you, and please treat them in the best way you possibly can.
Super. So just before we come to the end of the podcast today, is there anything you would like to speak about, Vicky? Is anything you've heard from kind of your discussions, and if there's anything, if there's information that can be shared here now, I suppose it's a good way of doing it.
I've mentioned, we've got a lot of positive feedback, and people understanding that prescription journey is something that we try and explain as well. But one thing that we do get in engagement, we do get a lot of people who ask about Medipacks. They've used them in the past. Now they're not getting Medipacks. They don't seem to understand the reasons behind that. I know I've had discussions with Jane about it, but I thought it'd be really good if we could just explain the reasons behind not accessing Medipacks from pharmacies anymore.
Sure. And we could probably do a whole podcast.
I know, because everywhere you go, honestly, every single time I go anywhere, that's what people say to me. Yeah.
So where do we start? Well, I guess first of all, there is no NHS commissioned service for the provision of a Medipack.
Yeah.
So any community pharmacy that offers that service is doing it out of their own goodwill. We talked about some of the financial pressures to the sector, which has led to some companies not being able to take on any more new patients, because they've obviously had to direct the resources that they've got in business in doing the core business and not being able to offer additional free services. It's why you may also be aware that some pharmacies can no longer offer free delivery services as well, because again, it is something that it may mean that the pharmacy closes if it continues to offer a service that isn't paid for.
Yeah.
Then we go on to the aspect that there are a number of patients who may request a Medipack, or family members or carers may request a Medipack, and it might not actually be the best solution for that patient. So we've got, I guess, a cohort of patients that may be receiving a service that don't need to receive the service, which that then causes a kind of a gap in the being able to provide it to those patients who really do need it. So it's. I think if a commission service was available that was targeted towards the right patients, that would be a fantastic outcome. But we've also got, I guess, you've got to look at whether Medipacks are being requested because there's a lack of funding in health and social care, and patients actually haven't got the right care package around them. The compliance aid as a tool, it is fantastic. It can help patients to take their medications at the right time, but it's not a one size fits all, and it's not a solution that's gonna fix it for everybody.
Yeah, absolutely. Thank you for that. That's really helpful.
Yeah, that was a great discussion, I thought. Is there any key messages you'd like to get out there, Pete, or do you think we've covered everything?
Yeah, I think we've covered it. I think we've covered a lot. It's been good. It's been great chatting.
Whistle-stop tour of community pharmacies.
It's been great. It's been great chatting to both of you. What I would say, I'd be more than happy to come back and chat about anything specific in the future. And yeah, I guess the ongoing message is that your community pharmacies are there. They're proud to be part of your local communities and support the communities that they're in.
Super. So if anyone who listens to this podcast has any questions or feedback, then do get in touch and we'll absolutely pass those on. And as Pete said, get him to come back on and we can tackle those questions then. Have you got the contact details there, Vicky? Put you on the spot every time, don't I? I'm so sorry.
You can contact Healthwatch, and if you've got any experiences or any questions about pharmacy, we link so closely. We can ask those questions and answer them for you. So you can contact us on our free phone number, which is 0800 118 1691. We've got a text only number as well, which is 0745 1288 789, or our websites are Healthwatch Middlesbrough and Healthwatch Redcar and Cleveland. So there's loads of ways you can contact us, and we can ask community pharmacy and, as I say, come back to you.
And one thing I would say is that the NHS website, if you do have access to that, is incredibly useful for being able to see the services that are available from local community pharmacies. There's lots of tools around finding your local pharmacy and finding the services that it specifically offers.
Yeah, and I should have said, and I forgot, we've got on our website, we have a pharmacy mythbuster guide, and it talks about that prescription journey, and it was produced in collaboration with community pharmacy, so it talks about the pharmacy first and lots of different things. So if you're wanting to take a look at that, that's on our website as well.
Super. Cheers for your time, both.
Thank you.